now it's my pleasure to introduce our first seminar speaker. I would like to welcome Dr. Julia Chen-Sankey. Dr. Julia Chen-Sankey is a social and behavioral public health scientist and assistant professor in the Department of Health Behavior, Society and Policy at the Rutgers School of Public Health, as well as a core faculty member of the Rutgers Institute for Nicotine and Tobacco Studies. She earned her PhD in behavioral and community health from the University of Maryland and also holds master's degree in public policy with a certificate in health disparities and disease prevention from Johns Hopkins University. Her research program is both broad and impactful. She studies the influence of flavored tobacco use and marketing on youth and young adults, as well as disparities in tobacco use among racial and ethnic minority populations. She combines approaches from behavioral science, neurocognitive research, epidemiology, and commercial marketing to generate evidence that informs prevention and tobacco regulatory policy. Over the years, she has been recognized with numerous awards, including the Judy K. Black Early Career Research Award from the American Academy of Health Behavior and NIH Matilda White Riley Early Stage Investigator Award. She also holds multiple other awards from Rutgers University and the Society for Research of Nicotine and Tobacco. She is very accomplished and well-funded investigator. She is the recipient of a prestigious NCI FDA Pathway to Independence Award in Tobacco Regulatory Science, where she examines how marketing research shapes neurocognitive reactions and intentions to use tobacco among young adults. She has also secured pilot and collaborative funding from NCI, NIDA, and state-level and public health agencies. She has built an extensive publication record with over 80 peer-reviewed papers spanning from tobacco marketing, disparities, and most recently cannabis product marketing and perceptions. Her scholarship continues to shape the evidence base for both research and regulatory science in very important ways. Today, she'll be sharing with us her talk titled E-Cigarettes Marketing and Young Adults, Understanding Appeal, Engagement, and Behavior to Guide Regulation. Please join me in welcoming her to the podium.
Thanks so much. All right, good afternoon, everyone. Thanks, everyone, for your attention and time today. And thanks, Dana, for the invitation for me to give this talk about my recent research. Again, I'm Julia Chen-Sankey. I'm a currently assistant professor at Rutgers University. So I'm just going to start on my slides now. First of all, the grants that I will be presenting, the work I'll be presenting today is funded by NCI, which is an FDA grant on tobacco regulatory science. Some of the other work is also funded by U54, which is the T-Course grant. And I have no conflict of interest to report. So a lot of the work I talked about today is going to be from the K99 project that I just mentioned. But there is also some recent work funded by other pilot studies. I will be talking about the background of my research, the past and ongoing research studies, and then the key takeaways, implications, and future research directions in this kind of order. So first introduction, I think this audience is all experts on this topic, so I'm just gonna talk very quickly. So we all know that nicotine e-cigarette use among youth or adolescents have been going down in recent years after the FDA regulations, but for young adults, it's still actually going up. So you can see this figure, the red the line is showing the prevalence of young adults aged between 80 to 30. From 2017 all the way to 2023, this past year use of young nicotine vapes from 14% to 25%, still going up, so doubled in the past 10 years. So we know nicotine e-cigarette use can lead to addiction, risk of using cigarettes and other tobacco products, lung illnesses. So we all know the consequence of e-cigarette use. And then for those who are smoking cigarettes or have established cigarette smoking behavior, substantial evidence has shown that switching completely to e-cigarettes can reduce the exposure to harmful chemicals. So for those young adults who are already smoking cigarettes, the complete transition may help with the public health impacts. So we're seeing this very two unique populations here. One is naive to tobacco. We want to prevent nicotine e-cigarette use. But for those who are establish cigarette smoking behavior, especially those who have used other nicotine replacement therapies and there's no positive results. We want to see if e-cigarette use can actually reduce harm among this population. So one of the main focus of my research is really from the marketing influence perspective. We know there are many risk factors of e-cigarette use, but the perspective that I was trained for and my K99 is about is really the marketing influence, because we know marketing materials are really the intention of those materials is changing people's perception, trying to make them use the products, right? That's what the industry is trying to push to increase their sales volumes, trying to sell the products. So back in 2017 and 2018, when I wrote my K99, this is kind of the ads that you're looking at, right? Probably not too much disposable ones back in the days, but mostly like those cartridges, right? This is a website ads that, which brand is it? It's hard to tell, but this is Logic. This is back in the days where Logic has all kind of fruit flavors. This is a Juul ad. You can see this is one's to be the most popular e-cigarette brand in the country. And we also have those brands that has very strong dessert and, fruit flavors as well. And there's also Blue. So this is how e-cigarettes used to be marketed. And this is like a very new disposable products. That's kind of recent trends of this is the products that's flooding the market right now, not the other kind of major brands of e-cigarettes. More than 80% of US young adults were exposed to e-cigarette ads in the past 6 months. So we're seeing, this is the data several years ago, but it's a majority of the populations, were exposed, right? Self-report data. So when I wrote the K99 grant, which is, again, it's under the TRS mechanism, which is the tobacco regulatory science focus, we were really thinking what kind of evidence can contribute to policymaking, right? So we know because of the First Amendment, we cannot eliminate advertising. So, but FDA and local health agencies can regulate features. So there are so many components on the ads that really together make an impact on perceptions and behavior. But what are the roles that each components or features are playing? That's, 7 years ago, that was very limited evidence was showing what are the features that's really impactful. And then later, after I submitted K99, FDA started to regulate e-cigarette marketing, and then really proposed that all the e-cigarette companies need to submit an application to get pre-market review and approval before the product can go on the market. So, and then one of those review criteria is that all those companies need to submit a marketing plans of their products to FDA, and FDA will look at the marketing plans and decide, okay, this is a good plan to reduce their appeal among youth, but for smokers, it might encourage complete transition to e-cigarette use. So that's what the FDA's role was playing. So part of my case is also trying to use those feature level evidence to inform their decision-making on pre-market product review. And then according to the advertising theory, as you can see here, means and approach, that we know the companies, the industries, for-profit companies are using ads to really sell their products based on the product features, benefits and functions, use those to sell their products. So those are the theory that really is showing those advertising features are changing people's expectancies and use intentions and interests of the products. So based on all of those reasons and the backgrounds, I proposed my K99 to look at e-cigarette marketing features influence among young adults. As you can see, this is like a most comprehensive list of e-cigarette ad features that I found through content coding, through my other types of later work. Those are very generic kind of categories, but you can see some of the categories you probably have seen in some of the ads already. Like we have flavors, tons of flavor descriptors and images and sensation claims. We have cartoons. We have some regulatory claims such as minor sales restrictions, nicotine warning labels, right? Those are more regulatory kind of features on it. And there's other model and people. There's young models and people that we're also seeing in some of the old e-cigarette ads. Positive experience claims such as convenience and discreetness. We have price promotion, lots of price promotions, right? We have product packages on it. There's a lot of shopping and purchasing information, online shopping or retailer marketing information. There's also a whole lot of smoker targeted claims on e-cigarette ads, such as saying switching is good for you or make the switch, right? It's a lot of switching messages on e-cigarette ads. So those are some of the general categories that we're seeing. Again, as I mentioned already several slides ago, we're seeing this very two different populations of young adults. About 70% of US young adults or those who do not use tobacco, right? They're naive to tobacco. We do not want them to use e-cigarettes, nicotine e-cigarettes at all. But there's also 20 to 30% of US young adult population who are established cigarette smokers. They've smoked since they were teenagers. It's hard for them to quit. They want to quit, but they don't know how. For this group, we want completely switching from cigarettes to e-cigarettes to reduce their exposure to harmful chemicals. So we're seeing these two very unique populations here. And then the entire theory and conceptual framework that really builds my research so far is message impact framework. So message, you can kind of picture it as marketing materials or ads. So we're based on this framework. We have this ad exposure, right? Young people are seeing those e-cigarette ads. And the features in those e-cigarette ads are influencing their receptivity, right? Whether they perceive it to be appealing, they like the ads, or they want to see the ads more. So that's receptivity phase. After this phase, we're seeing those behavior precursors being influenced, such as perceptions and intentions of using the products, mostly positive, because that's what ads want us to do, to generate positive perceptions. And after that, we're seeing behavior change, right? Either seeking out more information about the products, talking about the products with their friends and family, or going to the store to purchase them, or click on that link where you're seeing those social media influencers and trying to find out more information about where to purchase the products. So we're seeing this kind of hierarchy of behavior change influenced by ads, e-cigarette ads. Mm-hmm. So in the red boxes, those are the kind of the measures that I usually use based on each steps of this impact. So ad receptivity is really measured by attention, right? Where they're looking at, how long they're looking at it, how quickly they're looking at those ads, and their reaction. Do they like it? Do they think those ads are great, right? Or appealing? And then to perception, intention, and behavior. And here are some of the major measures that I use under each category as well. Again, for perceptions and intentions, I'm not only measuring product use intention, but also switching intention for smokers based on the two buckets of young adults that I just mentioned. And then the goal of looking at intentions and behaviors is really trying to identify high impact features. Thinking about, among all the features we just talked about, what are the really high impact features that can change people's behavior that we can intervene on, or the policy can take actions on. So those are the ultimate goal of this research, is to find those high impact features. And then the moderator being the young adults' tobacco use behaviors. Some of them are naive, some of them are established tobacco users. So that's the moderating kind of a factor that I usually use to look at this research question. So I use many methodologies for my study. The K99 originally proposed to do eye tracking experiment, which is an in-person lab-based study where participants look at some of the ads using an eye tracker on a monitor. So the eye tracker is right at the bottom of this monitor. Participants sit in front of a computer. They'll look at a bunch of ads, and then we'll monitor their eye movement to capture in real time, objectively, which part of the ads they're looking at. But during COVID, because that was the first year of my K99, we couldn't do in-person studies. So we pivot to doing a heat map experiment where you can see on this Qualtrics feature. This is a Qualtrics function of heat map, where participants can also look at an ad online on a survey, web-based survey, and they can click on components of the ads to indicate their attention. So it's a subjective way of self-report their attention instead of eye tracking as an objective measure. But again, because of COVID, this is the only way we can kind of sort of get in attention data. So we did heat map experiment on Qualtrics to capture subjective attention using this kind of feature. And I also do online experiment with randomized exposure. So kind of really draw the causal effect of exposing participants to one kind of feature and their perception change versus participants not exposing to that particular feature and see their perception change. So only this kind of experiment can really draw the causal effect between feature exposure and behavior change. And for the lab-based eye tracking study I did, follow the eye tracking study, I also sit down with the participant, did one-on-one in-depth interviews, really get at like, this is the ads you were just looking at, tell me what you think about it. So in order to collect some follow-up qualitative data. So that data actually turned out to be super useful to explain the eye tracking data. I will go in depth a little bit more later, but those are the main methodologies I've used for this K99 ROO study. So now I want to kind of quickly introduce two studies that I use based on heat map function that I just introduced. Again, it's like a COVID emergency, like online study, but it turns out pretty well published in Tobacco Control. That was really a little surprising, but as you can see this ad, we kind of label the area of the ads in different sections and then label them based on the content, right? We have nicotine warning, we have this model or people, we have product image, we have claims, switching claims or smoker targeted claims, and we also have brands. So participants click on or tapped on each area of the ads that they self-report that they were paying attention to. Then after viewing each ad, we ask them, do you like this ad? Do you want to use this product? Do you want to switch this product, right? For this particular study, we only did among non-tobacco using groups. So none of those young adults are actually using tobacco. So there is no switching intention in this study. It was just use intention. So the results show that. I want to draw your attention to use interest because this is the measure that's closest to behavior change. You can see the red box here indicates positive association, the green one is negative. So the positive association here, if you go all the way back to the feature, it's discount, right? So if the participants say they click on discount features, they report it's actually more associated with use intention of the product. And then if they click on fruits or mint flavor, they also reported higher use intention. But if participants self-reported noticing nicotine warning, they actually have reduced use intention. So it's like there's no surprises here, right? We all know discounts, like the fruit flavors and nicotine warning serves that function. But this is one of the first study that kind of tease apart all those features and put them together and really understand among all those features when they're presented together, what are the kind of the main features that stand out to participants and change their perceptions. So that's the first heat map study. And the second one we did was after I joined Rutgers, I was thinking more about what about those young adults who are DO users. DO users basically are defined by those who use cigarettes and e-cigarettes at the same time, because those are the population who might be using e-cigarettes for switching, or they're just using e-cigarettes for fun, for recreational use, right? And all of them are smokers. So I did a second study looking at that population to see if I am gonna see the same results as the first study. So again, I exposed them to 12 e-cigarette ads on Qualtrics heat map function. As you can see, this is one of the ads in there that has a variety of features, right? Fruit image and product. We also flavor some of the sensation claims here, brands and package. Same research methodology, same statistical analysis method. And here's the results in terms of intention product switching. So this is the measure that really get at whether they want to use the e-cigarette to make the completely switching behavior. The green ones are negative association, the positive association is in red. So you can see the negative association, we're seeing nicotine warning again, that the participants who saw nicotine warning are less likely to report switching intention. And if they see the smoker targeted claims, they're also less likely to report switching intention. Tobacco flavor is also negatively associated with switching intention, but fruit flavor and fruit image are positively associated with switching intention. So again, I mean, to me at that point, the smoker targeted claims was really surprising because I saw it will be positive. It will be a positive association. Why would it be negative? So at that point, I didn't know why. I thought it was like a statistical artifact or something, but I'll tell you later on about why. Tobacco flavor, kind of surprising, kind of not surprising. Surprising because I know cigarette smokers are familiar with tobacco. They like tobacco flavors, so they will tend to choose more tobacco flavored e-cigarettes. That's why I find it surprising because we're seeing a negative association here. But also, like when you're facing fruit flavors for young adults, of course, they're going to choose fruit flavor over tobacco flavor. So surprising and not surprising. But in general, we're seeing this consistent pattern with the first study, right? Fruit flavor is a positive association. Nicotine warning is a negative association. Okay, and then after COVID calms down a little bit, I started this in-person eye tracking study where I invited participants over to New Brunswick, where Rutgers University is, to do a very similar in-person study for eye tracking, but that's objective measure of attention. They don't self-report, but we objectively measure their attention movements on those ads. And I did this study among young adults of varying tobacco use behavior, non-tobacco using or also smokers. So I did it among both populations. So a lot of the ads, very similar ads as the first heat map studies, looking at different features and looking at their attention, of course, and also the perceptions after they view all the ads. So for the attention data, which is measured by eye tracking, I specifically looked at dwell time, which is the fixation duration, right? You can see from the definition here is how long they're fixated or look at certain features of the ads by milliseconds. And another metric that I had is entry time, is time to first fixation. So how quickly they look at certain ad features when that ad is presented to them. So when they see the ad, a lot of them will usually look at model, right? They usually look at the model first, so that they have very short entry time to that model. Some of them might look at nicotine warning first, right? So they have short entry time to nicotine warning. So those two measures really kind of measure different things, but they're also kind of highly correlated for features. And after eye tracking, I gave them a survey asking them about their perceptions towards the ads and towards the products. This is a little bit hard to read, but this is the eye tracking results. As you can see for the dwell time on the left side, and then this is measured by two tobacco use group. One is non-tobacco using, one is those who smoke cigarettes. You can see for two groups, they're literally having the same pattern of dwell time, except for this one measure that's significantly different is the minor sales restrictions. So those who do not use tobacco look at the minor sales restrictions a little bit more than those who smoke cigarettes. But all the other features are having comparative kind of attention in terms of dwell time. And then smoker targeted claims were the most attention grabbing among both population. You can see it's much higher than other features, followed by positive experience claims and price promotions. We later find out that this might be the reason because there are a lot of text in those features. So the more text you have in certain feature, people just read it, have to spend more time reading it instead of an image, right? You have like a people's face, they might spend less time because it's an image. So that's something that we didn't consider when we were designing this study, but that's also an assumption. There could be other reasons, such as smoker targeted claims may contain information that makes them think about more, right? There's counter argument towards smoker targeted claims, which I will introduce very soon from the in-depth interview. And in terms of entry time, we're seeing, so entry time, we want to look at the lower one, right? Because the quicker they're looking at certain things, that means they pay attention to it, most salient to them, the feature. So the lowest entry time is multiple flavor descriptions. We have certain features that have multiple flavors in it, so that's really fast in drawing attention, and also followed by nicotine warning. So nicotine warning is also pretty low, and people, which is models and their faces. So those are the three features that really drawing attention very quickly. So you can see they're kind of different, right? Like dwell time, that's like they spend a lot of time on, is a little bit different than those with short entry time. So this is the main eye tracking finding. And then when we are running the regressions of looking at association between the eye tracking measures and the perceptions, we're finding that those who spend more time looking at multiple fruit flavor descriptors was actually more likely to report this e-cigarette being interesting and appealing to use. So attention to multiple fruit flavor descriptors has that association with interest of using, right? E-cigarette appeal. We're seeing those who look at fruit flavor descriptors faster when they're seeing an ad has a negative association with positive. So the faster they're looking at the ad, the more likely they're going to have this positive e-cigarette use expectancy. Again, it's also fruit flavor feature really stand out. So this kind of regression really showing us maybe looking at certain feature will be associated with or causing their perception change towards the products. So after the eye tracking study, I was looking at the, this is the in-depth interview study. I jumped ahead a little bit. So this is the in-depth interview study that I did right after eye tracking study. After they finished eye tracking study, after they finished the surveys that I just talked about, I sit down with the participants and started to ask them questions. I had a whole guide basically asking, open-ended qualitative interview questions. What came to your mind when you saw those e-cigarette ads, right? It was really a discussion, it was really a conversation. What was the one ad that stood out to you most and why? And then could you describe particular features or components of the ads that stood out to you? So they started to talk about the fruit flavor I really like, that smoker targeted claim I really didn't like, the nicotine warning that makes me think. So they started to talk about all kinds of features. And then when they mentioned one feature, I basically just follow up with more questions like, why do you like it? Why don't you like it? Right? Like all those follow-up questions. So that was the in-depth interview. So the in-depth interview the data was so interesting that gave you a whole story of why this feature gains most attention. Because when you're just looking at eye tracking data, you're like, okay, participants like to spend a lot of time on this feature, but you don't know why. But this IDI really gives you so much information. So you can see lots of participants talked about fruit flavors appealing and generate use interest, right? They were saying, I really like this blueberry taste. I like blueberries. Maybe I'll like this blueberry too, which is the e-cigarette that they talked about. That would be a comforting factor. And smokers love it too. They're just appealing, the colorful ones. They make me think about my vape and which vapes I want to try. I like to try different flavors and experiment. And then for smoker targeted claims, which is very kind of the opposite direction, which I was thinking from the heat map function, because the heat map papers show the smokers who looked at it are less likely to use the e-cigarettes or completely switching. And then I found the same pattern in the in-depth interview because smokers and non-smokers find those claims to be unconvincing and reduce use interest. They mostly think that those claims are made by the industry to manipulate them. So they build a lot of counter arguments in their head to think that, okay, you're trying to make me to buy this product. I'm hooked on e-cigarettes. Now you're trying to sell me a new product. So there's a lot of like counter arguments, a lot of the suspicious kind of thoughts going around a smoker's head. So that's why they looked at the features for a very long time, because they're trying to like make the argument based on their own beliefs. So you can see from those who do not use tobacco, this person said, these messages made me less interested because it's making such a bold claim with no proof. It's just saying it, so it doesn't convince me. And the smoker said that those claims kind of make me want to use e-cigarettes less because it's like, well, you're still bad. Like those are still bad products. They're not good for you. They're just an alternative, and that kind of sketchy. Sketchy is used by a lot of our participants. They just do not believe an e-cigarette company sell this to me to help me. they're very against that belief. So that's why we're seeing this use intention, switching intention by looking at this claim is really reducing those intentions instead of increasing the intention. So without the in-depth interview, I probably won't get at why, but this is really explain a lot. And we're also looking at price promotion as an influencing factor, which is very straightforward. Nicotine warning on reducing use interest among those who do not use tobacco, which is, based on evidence, this is also pretty straightforward. We're also seeing actually smokers, when they're seeing nicotine warnings, also reduce their perceptions or interest in using the products. Positive experience testimonials, especially those Juul ads, all has testimonials on the side, meaning describing the convenience and discreetness of using e-cigarettes. They really love that. And then a lot of them actually praise to see that. They think it's very effective. I'm sure Juul spent a lot of money testing that out, and then that's why they put it in their ads everywhere. So those are the main study from the in-depth interview, which I find super helpful to explain my heat map results and my eye tracking results. And then after that first eye tracking experiment, that was the time of 2022, where disposable e-cigarettes started to take place in the market. I don't know how much you have seen disposable e-cigarettes. Those are the e-cigarettes that really came to the market after FDA started to regulate e-cigarettes. And then disposable, because it's a loophole and it comes in flavors, it's very cheap. So it started to take over the entire market. So then, and a lot of the kids and young adults are actually exposed to disposables on social media, because that was the major communication channel of selling e-cigarettes. So then I started to think, okay, what if we do an eye tracking study from social media content on disposable e-cigarettes, and then to see their perceptions. So I ran like the same eye tracking study, and then I found, I think it was 32 disposable marketing ads from major brands of disposable products, and exposed them to the young adults who are either non-tobacco users or cigarette smokers. Again, I looked at dwell time, I looked at entry time, I looked at positive perceptions. So this is like a typical kind of a social media ad for disposable products. And then again, the dwell time, as you can see here, participants looked at product descriptors a lot. They look at social media account information a lot, which makes total sense. They also look at the package a lot. And in terms of entry time, the young model, or the people's faces, draws attention most quickly. So you can see that's the lowest. Followed by some of the personal items. There was a lot of like computer parts, there was plants, household items that draw attention very quickly, and nicotine warning also. Again, not a lot of differences between the two tobacco using groups, which is it's actually a surprising result. I was originally thinking for those two groups, they'll be looking at very different things, but actually no, they are looking at things in a very similar way and then in a similar pattern. Okay, so the results show that those who look at the product packages longer were actually reporting more interest in using the products, and those who look at fruits, candy, flavor descriptors quicker, and the price promotion quicker, they're also having more positive product perception. So very sort of similar findings in the first eye tracking study and some of the heat map study. So we're seeing a very consistent patterns after those 4 eye tracking and heat map study on very concentrated in several features, right? A lot of fruit flavor stuff, a lot of like price promotion, smoker targeted claims. We're starting to see some of the trends and patterns from those 4 studies. And then fast forward to 2024, I think this study was done in 2024. This is the last study of my ROO, which I proposed to look at the impact of high impact product features based on eye tracking study and other study to do using a randomized control trial. So this study really, really trying to look at, as you can see the title, right, high impact fruit flavor, because as you can see from the results, a lot of the high impact features we found are fruit flavor related, right? Descriptors, claims, images, based on those previous study and from other researcher studies as well, not just from mine. So I decided to do, for the last aim of my RO, I decided to focus on this, which is like, it's also interesting because my whole dissertation is on food flavor, the flavor e-cigarettes. So I'm like going back the whole circle, basically trying to do flavored stuff again. So, the fruit flavor was chosen because based on the previous study, we're seeing all those flavors, participants really react to fruit flavors in a more positive way. It is also shown in literature that really draws positive perceptions more than other flavors among young people in the country. But when you're looking at those fruit flavors, in the eye tracking study and the heat map study that I did before, I really lumped all the features together because I just couldn't tease them apart. The area of interest will be too small. But you can see this list of fruit flavors. There's many components that go into it. We have the fruit flavor name. We have product color that corresponds with the flavor, such as green for apple, yellow for pineapple. We have the image of the flavor, right? When you see a strawberry, you know instantly that's strawberry flavor. So we have that image. And then we also have the sensation descriptor that describe the fruit flavor, which is often refreshing, sweet, tasty, those descriptors. We also often seeing this flavor choice claim. They will say like, you have a whole selection of flavors you can choose from. So those are some of the main components of fruit flavors that we observe from our content coding for those studies. And in particular, we think strawberry flavor is the most enticing flavor based on our study. And it's also most common e-cigarette flavor sold in this country based on some of the national data. It is one of the most appealing flavor found for use in young adults. So we decided among fruit flavor, we're gonna be focusing on strawberry flavor. So this is the ads you're seeing nowadays in gas stations. If you pay attention to some of the tobacco ads, you don't see those fancy ads I just showed you like 7 years ago anymore, right? That was before the FDA regulation era. This is the ads you're seeing. Some of the ads you're seeing for Logic, for example, they have the yellow background, but all the other stuff, it remains the same. So we're seeing a very different landscape now in terms of marketing e-cigarettes. I had a really hard time finding marketing stimuli for my eye tracking study because they don't exist anymore. So I have to dig out the old ads. You can see in the past 7 or 8 years how e-cigarette marketing landscape and regulation landscape changed so much. But this is ads we're looking at. So I decided for my last aim of RO, I'm going to use the current ads to design my study instead of the before the regulation ads. And I called it a regulatory status quo ads because those are the products that's being approved by the FDA. You can see they're all like dark gray and black kind of package color, make it the least use appealing possible. That's the products that are authorized by the FDA. And the product name, I have it there, is exactly the products that's being authorized and the image of those products. And those are also the ones you're seeing in the major gas stations that are being sold and in a tobacco shop, legal products, right? All the other products, it's kind of illegal, such as disposables. So for the last aim of RO, I really think hard, like what if FDA authorized flavors, fruit flavors? Let's think about it. What if, right? Because my whole goal of my research is trying to inform FDA. So I want to think about what they're thinking about. I mean, I know fruit flavor e-cigarettes some of the applications are being sent to FDA. They of course rejected it, right? But they still have to review their evidence. They still have to make the decision. So I thought, what if FDA authorized fruit flavors, because we're seeing from our own study that young adult smokers really like those fruit flavors, right? We know they're impactful. So I thought about that. And then do we know those fruit flavor ads impact among young adult smokers? We don't know. There's very limited evidence on that. And then do we need evidence to inform regulation decision-making? Yes, we do. So I decided to design this study based on fruit flavor e-cigarettes, but using the products that's currently being authorized. So you can see this is a web-based randomized exposure experiment among young adults recruited through Qualtrics. I have about 1,000 participants who do not use tobacco, 1,000 participants smoke cigarettes but do not use e-cigarettes, and about 1,000 participants who smoke cigarettes and use e-cigarettes at the same time. So 3 very distinct populations. I exposed them to those ads. So they were divided into 6 groups, randomly divided into 6 groups. So each participant in the group saw one of those ads. I gave them 12 seconds at least to look at the ad. So you can see this is the condition one or control ad. This is a status quo ad we have, classic tobacco flavor. This is the only flavor that was authorized when I was designing this one. Now there's also menthol flavor, but when I was designing the ad, it was only tobacco. So this is like no other flavor descriptor, right? Just the flavor, just the classic tobacco. And then condition 2, I added strawberry instead of classic tobacco, just to give participants that this is actually strawberry flavor. And for condition 3, I basically changed the color. So it's not just strawberry, but it also changed the color to red to indicate this is the red package with strawberry flavor. And condition 4, I further added the strawberry images to the ads. And condition 4, I further even add on top of condition 4 the sensation claim, so bursting with sweetness and freshness. And in condition 6, I further added a flavor choice claim, discover your selection of unique flavors. So kind of layer on top of each previous conditions to add something more. Because of the number of features I was testing, I couldn't do a full factorial study design to capture the independent and combined effects of each condition. So this is the only way I feel like I could still test, okay, if we have this one, if we're adding flavors, whether it's going to change anything. So that's why I had this study design here. And after participants were exposed to the ads, they were asked to answer questions about their intentions of using the products, their perceptions of the products. And this study was registered in clinicaltrials.gov. In terms of the results, it's interestingly that we're finding a lot of the results among dual use group instead of the other two groups. So for dual use group, we're seeing their using tension increased based on all of the conditions, right? Compared to control. Even we just change classic tobacco to strawberry, but nothing else. This group using tension went up. And for switching tension, we're seeing adds of condition 4 to 6 makes a difference. For those who saw ads 4 to 6, they're reporting they're more interested to make the complete switching, compared to the control condition. So those 3 ads have that kind of effect on complete switching. And for perceived ad appeal, we're seeing an effect also among dual use group only. So they're perceiving ads 3 to 6 more appealing than the control condition. Again, also only among dual use group. And in terms of sensory appeal, this is the only outcome measure we see that's having an effect among all the groups. So all the ads were showing increasing the sensory appeal of the products compared to the control. So this is only one that's significant among all 3 tobacco use groups. And lastly, we also measure risk perceptions, but there's no change at all, which is a little surprising, but we're not seeing anything risk perception change among any group. So you can see those results that dual use group is really, really affected by those features and the different conditions versus other groups. And lastly, I recently did this study where I want to test more policy-oriented features. So I did this study. This is among both youth and young adults. For young adults, I also have the smoker population, but for youth, this is non-tobacco using population. I did this study with Dr. Olivia Wachowski, and then we were interested into looking at reduced chemical exposure claim in e-cigarette ads, because we know some of the very well-known tobacco products that received MRTP claim, which is the modified risk claims, is like IQOS. In their ads, they have the claim in there, reduce the chemical exposure to this products can reduce blah, blah, blah. So they have those claims in their ads, but nobody really, or very limited evidence is available to test that claim effect in an e-cigarette ad. So we kind of design a study trying to design it for FDA authorized e-cigarettes and adding a claim in there to see using young adults perception change. So you can see this is the stimuli that we designed. All of them were authorized e-cigarettes from 3 different brands and products. And then you can see we added the claim in here. The claim says completely switching from using cigarettes to this product reduces exposure to harmful chemicals, really mimicking what's said on the IQOS ad. And then it has 6 conditions because we have 3 different products and 2 message condition. One is with the message, one is without the message. So there are 6 conditions in total. And then we measure ad appeal, just like the previous studies, product use intentions, risk perceptions, and effectiveness, perceived effectiveness of the claim. And the results show that I didn't see too much impact from those experiments, from this experiment, honestly, because we're seeing for ad appeal and ad effectiveness, this measure is purely for ads. This has nothing to do with product use intentions or perception. This is just for ads. We're seeing there's no effect among those who do not use tobacco, but for those who smoke cigarettes, those who view the reduced exposure claim were more likely to report the ad made them want to use or switch completely to use e-cigarettes. So we're only seeing this effect of this ads among those who smoke cigarettes, but it's only at the ad level. Because if you look at the use intention results, there's really not too much going on. There's no effect among those who smoke, right? They do not report they want to use the e-cigarettes more. But for those who do not use tobacco, when they see the reduced exposure claim, they were more likely to have higher use intention of the e-cigarette compared to cigarettes. So it's not absolute use intention change, just relative use intention change. So we're not seeing too much going on for use intention, which means if they look at this one ad, it doesn't really change their use intention at all for both groups. And for risk perceptions, we're seeing something also among those who do not use tobacco. Those who look at the reduced exposure claim were more likely to perceive the e-cigarette as being less addictive than cigarettes. And there's no effect among those who smoke. So again, for those who smoke, we're not seeing too much things except for the ad appeal and effectiveness. We think it could be very brief exposure of those messages, of those ads among our users. And it's pretty dull. This ad is like one of those ads when you look at it in a gas station, you will never look at it again. Like, I just think they're just not interested in this at all, which also speaks to how those products use prevalence is so low in the market right now. Nobody's using them, even among smokers, but everybody's using those flavored disposable products. So what are the key takeaways after the studies I did based on my K99 RRO? So it was a lot of results, right? So I think that we're seeing there's like 20 different types of e-cigarette ad features that we listed in one of the slides early on, but the features really influence the appeal and use interest very differently. Some of the features never had an impact. Some of the features consistently have an impact across the studies. And this kind of influence really shares a lot of similarities among our 2 tobacco use groups instead of different influence. Some of the influence are really strong among our dual using group, which is not surprising because this is the group who smoke cigarettes and use e-cigarettes and trying to use e-cigarettes to quit for some of them. And then really, we find that the features that really highlight the functions and the benefits of directly highlight those functions and benefits are actually most effective in shaping product perceptions and use interests, such as price promotions, flavors, right? Like the direct functions instead of a model or like at a house plant, right? Like, so this is one of the findings that we also seeing from our study. So we're seeing, for example, food flavor increase product appeal and use and switching interest. Tobacco flavor decreased or reduced this kind of appeal and use interest among young adults. We're seeing consistently smoker-targeted claims reduced appeal and use interest. Positive experience claims increased switching interest among those who smoke. So those are the consistent data, the results and those are the high impact features as well, because those are consistently showing impact across studies. We also find that, interestingly, many attention-grabbing features were not necessarily associated with product perceptions. We're seeing models, people, personal items, social media accounts. Those are the features that draw attention very quickly among young adults. That's the first thing they look at. But when you're looking at their associations with perceptions, it really don't change anything. Participants talk about that in the in-depth interview. They just said, it's interesting to look at, but nothing, happened after you look at them. So those are some of the interesting kind of results based on eye tracking and in-depth interview. And then we also find nicotine warning consistently reduce use and switching interest among non-using group and among smokers. The in-depth interview actually shows for nicotine warning, smokers, we all know the misperceptions of nicotine. Smokers consistently think when they're seeing a message of reduced exposure to harmful chemicals, they're thinking about nicotine. That's what they're thinking about. So when they're exposed to nicotine warning label, which is standard on top of the ads, when they're also seeing the reduced exposure claim, they think the reduced exposure is nicotine. So they had even lower use interest. It's like the whole kind of interactive effects between the features and the misperceptions about nicotine all going around when they're seeing those two features together. And price promotion, of course, they increase the use interest, especially among those who smoke. And I think methodology-wise, we really need to have survey, in-depth interviews, and other neurocognitive assessments follow eye tracking, because eye tracking can only do so much to capture eye movement, but we don't really know the thoughts of the participants and why they pay attention to certain things in a certain way. It's a cool method. It gives us objective measures, but we need to do more following that. So those are some of the key takeaways. And I also have some policy implications that I found important to highlight, such as it is really challenging based on my results to make any policy decision, because we're seeing this very similar effect of ad features across tobacco use groups among young adults. What do you do with them, right? They're both appealing to both groups. And then for food flavor, price promotions, and positive experience claims, for smokers, they're really effective, those features, but they can also be appealing to young people who do not use tobacco. So looking at two things, we can't really ban one feature because it's affecting both groups in the same direction. And then for FDA cigarette market authorization, what we found is tobacco menthol flavors is really not appealing to young adults. They do not want to use them. And then, given the current products being authorized, that's why the use interest is so low. And then, so I just want to quickly introduce some of the future research directions. I want to look at more about what people's perceptions are about FDA authorization. We found in a recent study, young adult non-tobacco using group is actually impacted by this kind of authorization claim pretty strongly. But the smokers are actually not affected by it too much. But what if we put those messages in the same ad to test their reactions? That was one of the recent study we just collected data on. So that's not some next steps I want to do to inform policy decisions. And then I also have submitted a couple of NIH grants to use the same methodology for cannabis product marketing, very similar methodology to look at ad features. If you look at this ad, this really reminds me of 2017 e-cigarette ads that we're looking at, right? All those crazy features on it, has like this huge ice cream image at the bottom. So I basically proposed that study to look at that. And then another thing I was interested in too is to look at how do we measure behavior change, right? Because a lot of the study I did, and other investigators as well, we measure perception, we measure use intention. But how do we really know whether any of those marketing elements are changing their actual behavior? That's something I think it's very hard to do. It's challenging because you need a longitudinal study design. You need to really monitor studies participants for a long time. But my next step is really thinking about the actual behavior change. So this is all the information I have from today's presentation. I thank you for your attention and welcome any comments and feedback and questions. Thank you. Sorry, I know it's a lot of information.
That was very interesting and very informative. Any questions from the audience?
Question, great presentation.
Thanks.
So prolific number of studies. It's really impressive, and I enjoyed how they built on one another. I have a couple questions, but the one I'm curious, for your dual use group, how did you define that? Because I think that is done in very different ways and can impact different things.
Right, right. That's interesting. So cigarette smokers, they have smoked 100 cigarettes before and are currently smoking, which is measured by past 30-day use. And the e-cigarettes is also past 30-day e-cigarette use. So I know everybody look at it differently. Yeah.
Yeah, it's interesting just because it seems like predominant smokers, and then they were also allowed to use e-cigarettes.
Right, right.
Be curious if you had different findings if they were predominantly e-cigarette users.
Right. I didn't look at that. That's good. Because like when I was looking at smokers, I couldn't even find enough smokers who do not use e-cigarettes because it's
Sure.
the young adult population. Most of the smokers are also using e-cigarettes. So I had a hard time finding that. But for dual users, it's just so easy to find because that's what they use both products all the time. So yeah. Yeah.
And anybody online? We only have a couple minutes, so I want to see if there's any other questions that are coming up. While we're waiting, are there thoughts that your findings would differ based on different like priority populations? So I'm just wondering, maybe lower income or if they have mental health conditions. Have you looked at whether they would be consistent or potentially different across those?
Yeah, I haven't get a chance to look at that, but yeah, that would be really interesting, I think. I did look at, for FDA authorization study I recently did to look at smokers' intentions of using FDA authorized e-cigarettes, but I found those who from lower income backgrounds are really less interested in using it than those who are from higher income. Which, e-cigarettes are expensive, right? Like that makes sense. But what are the other things going to it? I was questioning, is it like the health literacy, that do they understand the message of FDA authorization? Or is it distrust of government when they see FDA authorized, right? There's a lot of factors going to it. So I think that's a pilot project I did. So I think next step is really trying to dive into the reason of why SDS smokers who need more help to quit are actually perceiving FDA authorized e-cigarettes to be less, trustworthy or less interesting to use. That was the only study I did in the past 5 years that has that kind of components to it. Yeah, so. Any other questions, comments? Don't have to be questions. Yes.
I was just thinking about how the marketing and promotion of tobacco product have changed throughout the years. So
Yeah.
now it's all about like social media promotion, sometimes
Right.
even promotion online.
Yeah.
In the past, it was like smoking in movies, in TV
Right.
shows.
Yeah.
everyone's
I mean, it's still
smoking.
there. e-cigarettes
Yeah.
is still there on Netflix. Yeah.
Yeah, and now I see so like on TikTok, influencers will receive like
Right.
packaging gifted from like companies, and they'll like they are not paid by the company, but sometimes they will show their like e-cigarette with their vape for a couple of seconds.
Right.
Like without knowing it, they're actually projecting like using this is cool or it's fun to like the viewers. And actually I'm on TikTok a lot, so I saw this trend on TikTok, like people young people, they are like take a deep breath of the e-cigarette or the vape, and they're actually covering their mouths with their clothing and try to exhale the
cloud
vape. Like with the beat of the music on TikTok,
Yeah.
and make a video of that.
Yeah.
And I was browsing through the comment, and some people were like, "Oh, this is cool, I will try it." And some people are like, "Oh, vaping is not good for you." And so I see this very divided comment section, which is just
Right. Yeah. Well, some of them actually paid by tobacco industry.
Really?
Yeah. And they don't sometimes they don't disclose that, but
Yeah.
they're required to disclose that, but most of them don't.
Yeah, it's just very concerning.
Yeah, they're paid to promote their products. Yeah. So.
Any other questions or comments?
Yes.
Nothing on this point? Well, Thank you all for coming in today and thank you for that wonderful
Yeah.
presentation.
Welcome. Thank you for saying that.